The vagus nerve arises from the medulla. It courses through the jugular foramen and descends within the carotid sheath. This nerve has various branches throughout the body. In the neck region, it first gives off the pharyngeal branch, originates from the inferior ganglia. Its plexus innervates the motor function of the pharynx and palate, and therefore is crucial for swallowing. A lesion to the pharyngeal branch could cause the inability to swallow. Next is the superior laryngeal nerve, which has two branches. The external and internal laryngeal nerves. The external laryngeal nerve controls the motor function of the cricothyroid muscles. Lesion to the external laryngeal may cause pitch change in speech, and more specifically, an inability to make explosive sounds due to the paralysis of the cricothyroid muscles. The internal laryngeal nerve is in charge of the sensory of the laryngeal mucosa. Irritation to the nerve may cause uncontrolled cough, versus a lesion to the nerve may cause loss of the cough reflex, thus increasing the chances for food aspiration. And next up is the recurrent laryngeal nerve. Remember in the trunk dissection, its left branch hooks around the aortic arch and the right branch hooks around the right brachiocephalic artery. It innervates all the intrinsic muscles of the larynx except for the one we just talked about, the cricothyroid muscles. It controls the opening and closing of the vocal cords. The recurrent laryngeal branch is also responsible for the sensory input of the mucous membrane of the larynx below the level of the vocal cords. A unilateral deficit of the recurrent laryngeal usually results in a hoarseness of speech, while a bilateral damage to the nerves could result in the inability to speak and sometimes difficulty breathing. Cranial nerve 11 is the accessory nerve. The accessory nerve we're talking here is actually the spinal accessory nerve because its roots originate from the cervical spinal cord. It courses up through the foramen magnum and then down through the jugular foramen. It descends along within the internal jugular artery to innervate the sternocleidomastoid muscle and then cross the posterior triangle to innervate the trapezius muscle. The right SCM allows you to turn your head to the left and vice versa. The trapezius muscle allows you to shrug your shoulders, so damage to the spinal accessory nerve will cause weakness in turning your head to the opposite shoulder or lifting up your shoulders. So cranial nerve 12 is hypoglossal nerve. It rises from the medulla and courses through the hypoglossal canal. As it descends, it travels with the superior ansa cervicalis, it hooks around the occipital artery, and pass posterior to the sternocleidomastoid muscle to innervate the tongue. It is a pulmotor nerve, particularly it innervates the genioglossus muscles. It's a pair of muscles that allow you to stick your tongue out and move it from side to side. So clinically, a unilateral lesion to the hypoglossal nerve will cause an ipsilateral weakness of the tongue, and the tongue will deviate to the side of the nerve damage.